COMBI-v is a study which was done in first-line metastatic melanoma patients who carried a BRAF V600 mutation. This was a registration study at that time, testing the combination of Dabrafenib, which is a selective BRAF inhibitor, and Trametinib, which is a MEK inhibitor, in comparison to Vemurafenib, at that time registered BRAF inhibitor. So COMBI-v, combination of Dabrafenib, Trametinib against Vemurafenib. Endpoint of this clinical study, which was a globally performed study, was overall survival. And data were reported 2 years ago and showed a clear benefit in favor of the combination of Dabrafenib and Trametinib over the monotherapy using a BRAF inhibitor, Vemurafenib. So we now have 1 year overall survival rates for that combination, 2 year survival rates, and 3 year survival rates, clearly demonstrating the benefit of the combination. What was also interesting was at last year's ASCO, the sister study COMBI-d, which also used the same combination, Dabrafenib and Trametinib, in comparison to Dabrafenib, showed that patients who had this long survival benefit using the targeted combination, that these patients had also high mutational burden in their tumor samples before treatment. And this posed the question whether there is an interaction between the immune system and targeted therapy, whether those patients who have positive immunological makeup possibly also are those patients who have the long-term benefit. So in order to address this question, samples which were taken before patients got treated, which were used for BRAF testing of the tumors, were also used to analyze immunological characteristics in these tumor blocks. And if we try to understand which patients do benefit from immunotherapy, the concept of immunosensitivity, hot and cold tumor have been introduced, including factors like PD-1 ligand expression in the tumor, which we know is an important marker for sensitivity to checkpoint blockade, particularly PD-1 antibodies, but also that influx of T cells are a positive predictive and prognostic parameter. And what was now being done in this study was to analyze patients who got treated in the COMBI-v study in regard to immunological parameters, T cell infiltration, PD-1 ligand expression, and interestingly, you find this association between upregulation of PD-1, T cells, and also outcome.